Hello, facial palsy here, and today I just want to go over. I'm going to try to be brief. Basically, the order of things and treatment in facial rehab and addressing deficit from facial palsy. Once you have a correct diagnosis, and so again, that could be Bell's palsy, that could be Ramsay Hunt, that could be facial palsy from Lyme disease, it could be a nerve injury from a tumor that's growing around your facial nerve or your vestibular nerve, as well as a nerve injury in the process of removing a tumor, which is also a somewhat common reason for having a facial palsy. So anyway, once you have this diagnosis, and a lot of it is going to depend on the stage. So for some people, they're going to be with Bell's palsy, they're going to be given antivirals and steroids. Once you in around that time, you are likely in a flaccid paralysis stage, which allows you very little movement to no movement if it's a complete flaccid paralysis. At that point, your goal would be to maintain some mobility of your face with a gentle massage and stretches, as well as encourage some stretching for your eyelid to encourage your eyelid to close, as it is your number one priority, as well as stretching your strong side. So that would be in order to maintain some symmetry and regain some symmetry at rest. Once you start regaining some movement, there's more stretches to be continued, be performed, and at that point, you, depending on the amount of mobility, there are some neuromuscular retraining that you can do to improve your movement. This would be under the supervision of a trained facial therapist. The broad, exaggerated type movement with no control of speeds, things that you might have likely seen online, those are not recommended at that stage, as they are not specific enough and do not produce a coordinated movement and are to be avoided. If you end up not recovering at that point and regaining your movement within, generally that's between 2 and 6 months, you can develop some synkinesis, and synkinesis generally develops around between month 4 and 9. That can be depending on the level of degree of injury and how long that flaccid paralysis stage lasts. The synkinesis can appear later on. It's often the case that during before getting synkinesis, you've regained quite a bit of movement and you feel like, oh, I'm pretty much healed, and it is feeling so much better. But at that point, suddenly, that can be fairly quick. You start noticing the synkinesis and actually new tightness on that side, on your involved side. So you went from this to more like this. Sometimes at rest, sometimes if with movement, that kind of things. There's no two people have exactly the same synkinetic pattern. This is why treatment for synkinesis should be and is really only effective if it is addressed to the specificity of your synkinetic pattern, and not some other people. And this is why also I cannot answer questions in that regard when I'm being asked on the group, how do I have this presentation, what do I do? There's so many layers to this and so many things to look at in order to treat this appropriately, and it would be very much a disservice to give you just one potential 1/100th of a treatment just from that. So once you start and once you're in the synchronicity stage, this is when a lot of people start reaching out to me. To be fair, would have been much better to start to do so much earlier, as by that point, if the stretches had been started, the face would not be quite as tight. And stretching is, and I will repeat, the most important part of facial rehab. You cannot treat synchronicist without stretching. With synchronicist, you're always going to have specific areas, maybe the whole face, but more likely specific areas that are very tight and need to be stretched, and very diligently. And this can last for, and will last, months and sometimes years, in order to get enough flexibility in your movement that you can, in your face, that you can, during all this time, with the help of a facial therapist, work on retraining movements in an appropriate manner, and along very most often the case with Botox, with targeted Botox as well, and that goes on for this is a long process. I believe some of the studies were showing that most patients that are in receiving facial therapy, on average, it's 12 to 18 months. So that there's a huge variability, of course. Everybody is different, and everybody start at a different stage. So that would make sense to explain those differences. But please know that no matter, it's not about doing either the stretch or the Botox. You need both generally. And if all of this is not enough, then there's more various surgical procedures, from minimally invasive to more invasive at that point, to address symptoms. So even though that seems like a very tedious and long process, which it is, I do want to, my goal is to really trying to offer some of you some encouragement, as you are not alone. There are some people that can help you with this. It's just doing things in the right order and seeing the right professional for this. Again, facial therapists and otolaryngologists, which are ENTs, and ones, since there are so many subspecialties, and ones that specialize in facial nerve injuries, they are technically and very most often surgeon as well, head and neck reconstructive surgeon, and some of them really specialize in the treatment of facial nerve palsy, and they would be the one also injecting you with the Botox. This is very different than cosmetic Botox, so don't think that anybody that can inject you will do the right job, because that is not the case. So this was too long, 8 minutes, but I just wanted to kind of give a recap on what you're kind of looking at if you do not recover on your own with a facial palsy, which about 70%, 65-70% of people will recover spontaneously, even if they were doing absolutely nothing. I think doing nothing is not really the right case, even for these patients. I think they definitely benefit from massage and stretches, and I do see some patients in my clinic that are recently diagnosed, and I give them and provide them with the right information in regards to treating their symptoms, managing their eye, encouraging their eye to close, maintaining mobility with massage and stretches, and helping them every so often until their symptoms resolve. So even for these people, I think it's beneficial to get the right kind of facial therapy. Anyway, I'm almost at 10 minutes, so I'm going to cut it there. I hope this was helpful, and have a good day. And please don't forget to ask any question in this group. When it's a very specific question for treatment, it's very hard for me to answer and it's likely something that I would refer you to see a facial therapist or a physician for an assessment. But please ask any questions, and I will try to answer them as much as I can possibly answer them. And there's no dumb question, so please ask. All right, take care. Have a good day.